next up we have from Families for Addiction Recovery, Sydney Graham.
Okay, I move around. I want to make sure that I see everybody. So my name is Sydney. I'm the peer support manager for Families for Addiction Recovery. So first I want to say what amazing organizations that you have to vote on. I mean, everybody is so worthy. So a hand to those, and whoever it was that nominated us, thank you so much. And this is such an incredible organization. I'd like to be 101 because women can change the world. We are an organization started by two mothers who couldn't get any help for themselves when they had children that were absolutely suffering tragically by severe mental health and addictions. If it was happening to your child or your child, how do you know what to do? My son has borderline personality disorder and major addictions, and he is the most precious child in the world. And when all of a sudden he started changing behaviors that were so not like him, I had no idea what to do. And I had old biased opinions that my parents were giving me that were so wrong and I didn't know it. And I'm doing my best to save the life of my son, but he was dying. And the drugs were so bad and the mental illness is so bad, I used to watch him walk out the door and walk down the sidewalk thinking, I wonder if that's the last time I see him. So what we do is we treat hundreds of mothers. So our mandate is the families, and we have evidence-based strategies that actually make a difference. It is the #1 killer right now from 15 to 24 in Ontario and in BC. They're dying from overdose, and the system is not stopping it. The first time I went into the chief of psychiatry of one of Toronto's #1 hospital, and I tried to form my son because he was going to kill himself because he thought he was such a bad person, the doctor called him a thug and told me that I was to blame for that. The system is absolutely broken. There's not enough access to care. There's wonderful providers out there who are trying to do their best and are burning out. So we teach wonderful strategies that do work, and my son is doing awesome right now. And it's because of the strategies I taught him, not because of the doctors, because he wouldn't go. So I want to tell you really quickly, we do 3 things. One of them is family group supports, which are awesome because no matter what the substance is, or no matter what the debilitating mental illness is, we're all talking about, we're the family members, what's our role in this? And how do we communicate effectively and help them to move towards change? And it's wonderful to be able to talk to a community of people that actually get it, that aren't commenting on stigma and that we're to blame and how horrible our children are, because they typically have a hereditary brain disease. The second thing that we do is called a peer-to-peer support. So when you call the organization, fill out a small intake, you can get your own personal peer supporter, someone that has a very similar journey to one that you are experiencing, and you get one-on-one hour counseling every week for 8 weeks so that you can learn these strategies on how to reach these kids that have a very sick brain. The last thing that we do is called the live support line, and that's primarily what my job is, besides the major advocacy work that we do right across Canada. But we have treatment on demand. What a surprise that is in this system, since it's, even when they're suicidal, about 2 years wait list just to get any kind of help. But with our organization, you can call, and I'm on the phone every day from noon until 3. And we also open up Wednesday evenings from 7 to 9. So you can call me anytime during those hours and talk to me. And not only am I a parent, I am now, because we couldn't get the help, I'm a trained counselor and a skills trainer in cognitive and dialectical behavioral therapy. So there's many layers that we can be helping these mothers and fathers save the lives of these children, because it's absolutely desperate. So I've got 1 minute left, and what I want to do is just read to you quickly one of the testimonials that we got. And I can tell you, even when I do an hour intake, a lot of the comments that I get from the mothers who are absolutely distraught and can barely get the story out for crying is that they've learned more from me in 1 hour than they have 6 or 7 years in the system from any provider. These sessions were immensely purposeful. Repeatedly, I found myself feeling grateful that I discovered the existence of this organization. I only wish I had known it far sooner. Dealing with a child experiencing addictions, I felt lost. I gained indispensable knowledge from my peer support sessions, as well as confidence to help my child through the difficult journey towards recovery. My peer support person was professional, compassionate, flexible, and personable. She offered useful suggestions, advice, and resources. These sessions offered me peace within myself, knowing that I was offering the best possible support for my child. So we save lives, because the system isn't out there to do that. They're looking after the patient. We are teaching the many families who are doing about 100% of the care with their loved ones to help save lives. And we're winning the battle, but we need more people to know who we are and how to reach us. Thank you.